Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest technology trends in health IT. I'm going to be here sitting down with Zach from Milwaukee County, and we're going to be talking about their unique use of GIS for public health through the COVID pandemic with the lens of health equity. Zach, welcome to the program.
Thank you so much for having me, Colin.
This is going to be really exciting because, like I said at the top there, you were using GIS to help you through the COVID pandemic, but you used a health equity lens. Talk to me a little bit about that.
Sure. Well, our focus on health equity came about in 2019 when Milwaukee County was the first jurisdiction in the country to declare racism a public health crisis. And that kind of colored all of our intentions moving forward. So we have been trying to apply a health equity lens to every decision we make and everything we do. Mm-hmm. So when the pandemic struck, we had the people in place to make that happen.
Okay. And so how did you apply that during the initial part of COVID?
Sure. During the initial part of COVID, we reported data on race and ethnicity so we could get a true picture of the disease burden in our communities. And we were finding right off the bat that our most vulnerable populations and our people of color were the ones carrying that disease burden the heaviest.
Right. And what did that lead to in terms of actions or reactions from the county or from local community organizations?
Sure. Being able to know who is being affected allowed us and our partners to target our resources to those communities, tailor messaging, communications, have outreach with faith leaders to really work on that.
Yeah, to really motivate them.
Yeah.
And then later stage in the pandemic, you used that same lens and applied it to vaccination. Is that right?
Yeah, that's right. So we actually used the CDC's Social Vulnerability Index and put that on a grid with the other axis being vaccination rates. So we could visualize where was being vaccinated at the highest and lowest rates and how did that compare to social vulnerability. And when we first applied that, back in the early days when it was limited to healthcare professionals, the vaccination, that first dose, we noticed that the people who probably need to be vaccinated the most, the ones who are at the most vulnerable, were the least vaccinated group. And we were able to take that map to our leadership and say, we need to change our strategy. This is what the data is telling us.
Right.
Our county executive actually took one look at the map and went to the governor of Wisconsin and said, hey, we really need to rethink our policy here. And within days, they opened up vaccine eligibility to those communities that were the hardest affected, or the hardest hit.
Now, and you were telling me before we got on air that not only did you make this information available to your stakeholders and decision makers, you decided to make this available to the public as well.
Right. That has been a key component with our racial equity initiatives at Milwaukee County is transparency. We want to make that data, we want to use that data ourselves, but we want to make that available to everyone else to use in their day-to-day lives.
And you said you were a little bit surprised as to who was actually using that data from the public sense. You were getting phone calls with people saying, thank you for providing this. Is that right?
Right. It was really exciting. We knew we wanted our local decision makers to have that data. And once we made it public, we weren't sure who exactly would be using it. And to get that outreach from our community members, a lot of organizations that are invested in community health, to hear back from them saying, hey, this is great, we're using this, keep it up. Could you add a little more, something here or there? It was very exciting to see that engagement.
Sounds like there was a lot of sort of grassroots organizations who use that data to kind of maybe spur some action within their local communities, and that was a little bit unexpected.
Yeah, it's very gratifying to hear that your product's being used, most definitely.
Now, I was looking at your story map, which was on display here at the Esri User Conference, and it mentioned something called EVE. What is that?
Sure, that is a model that we developed, and EVE stands for the Evaluating Vulnerability and Equity model, and that is our vaccination strategy model that took into account vaccination rates and social vulnerability index. And we also hope to continue to use that later to explore other health phenomenon and replace vaccination rates with other things that we see in our community that we want to make an impact on, and be able to use that to target our resource allocation.
I was just going to ask that as my next question. Like, where are you going to take GIS next in your county? Where are you going to apply it? What other things are you looking at from a health perspective?
Sure. So with the Milwaukee County Office of Emergency Management, we house our Emergency Medical Services Division, and they really have a wealth of data to use from all the emergency calls going on in the county.
Okay.
And now that we understand the power of GIS, the ability to use that to make better decisions and explore different phenomena, there are a lot of projects on people's wish list moving forward. Specifically, we want to look at strokes.
Oh, okay.
And hopefully one day get into cardiac arrests and bystander CPR and figure out how we can target our resources and use what we have most effectively to serve our communities.
Right, everything from defibrillator access to maybe CPR training in those areas where you know there's high occurrence of those kinds of things. You can totally see how GIS can make a difference when looking at that kind of resource deployment.
Yes, most definitely.
Amazing. What has been sort of the most pleasant surprise for you in terms of internal acceptance of GIS at the county? I mean, did it start with one sort of map and one set of data and then blossom from there, or did you guys go big bang? How did that evolve at the county?
Sure. So when we started out, we knew that a map was going to be central, because no matter your level of data literacy, we're in the era of smartphones. People have a digital map in their pocket and they can use it successfully every day. And that was our grounding element when we were designing this dashboard.
Okay.
And slowly we started to build it as more statistics came in and became more relevant. And we're also really excited to not only have that really easily accessible things on our dashboard,
right?
But to also allow tools as time went on, build out those tools so that folks could dig in deeper. Like your seasoned public health professional, they have plenty of data at their fingertips to look at.
Final question for you. What's your advice that you can give to maybe other counties or other government leaders? How did you get all these people to come to the table and collaborate together? Because traditionally everything's pretty siloed.
Correct. Well, we had the unfortunate benefit of a crisis that really put everyone on the same team. But I am so grateful for our county leadership at all levels in Milwaukee County, the depth and breadth, the commitment to racial equity that is there allows me to do what we've done with this dashboard, that full commitment. And as far as advice for other folks out there, that's a really great question. I say swing for the fences.
Okay.
Yeah.
I love it.
Yeah.
I love it. And GIS is one of those common elements, right? It does bring people together because geography is something that everyone understands. And to your point earlier, we all understand how to use a map because we now have them in our pockets.
Yeah.
Amazing. Amazing. Well, Zach, thank you so much for being on our program today and for the great information you shared with us.
You bet. Thank you so much for having me again, Colin.
If you enjoyed this interview as much as I did, we'd love for you to mash that like button or subscribe wherever you're listening and watching this program. Also, head on over to healthcareitttoday.com to get the latest industry news and insights. I'm Colin Hung with Healthcare IT Today. Thanks for watching.